Recording? How's it going today, Mr. Rivera?
I've been better.
Good. Do the people call you Elder Rivera?
Yeah, that's what I go by.
Okay,
I'm on a
missionary?
mission, yep.
Oh, sweet. Where are you from?
I'm from Panama.
Panama? Okay.
Yeah, I've been out here for about a year on
Okay.
my mission, so.
Well, speaking good English for a year, so that's good.
Yeah, I've been learning a lot since I've been here. I didn't speak any before I came, so.
Oh, wow. Good.
Yeah.
Well, obviously, if you have any questions on what a word means, let me know.
Okay.
I try to speak in simple terms, but whereas your Spanish is a bit limited, if you have any questions, let me know throughout the exam, okay?
Okay, yeah, I'll do that.
Okay. So have you had any physical therapy before?
No, I never have.
Never have. Okay.
Yeah.
Do you know what we do?
I don't know, not really. They just told me to come here and you'd help me with, like, my physical fitness, I guess. I don't know.
Okay. Well, that's good. I'm glad they kind of gave you a little brief introduction, but just kind of tell you a little more about it. We're here to help you get back to how you were before. It looks like you had an accident, right?
Yeah.
We kind of help you get that muscular strength back, endurance, and we help give appropriate exercises so that you have bones and tissues that are healing. So as those are healing, we give you these exercises to help you maximize so you can heal faster, okay? And in a safe manner.
Yeah, that sounds awesome.
Okay. So what brings you in today?
Well, so a while ago we were talking to some people that seemed kind of interested, and I don't know, we went to the address they gave us, but I don't think it was their house. I think they gave us the wrong address, and a guy answered the door, and he was very frustrated, and I could smell alcohol on his breath, and I think he was drunk, and he got very frustrated and started yelling at us, and I couldn't really understand what he was saying, but he came out with a baseball bat and started attacking us.
Oh.
So, he hit me in the arm, and he hit me kind of on my side over here in my ribs, and then I fell to the ground, and he kicked me like in my head and my face a few times and hit me again in the back with his bat. So,
Oh my gosh.
yeah, that's kind of what happened.
Oh. Well, I'm sorry to hear that.
Yeah, it was kind of a scary experience for us.
Yeah, I'm sure. Well, and that happened just a few days ago, it sounds like.
Yeah, that was like a couple of 3 days ago.
Okay. Well, thank you for telling me that. I know it can be hard sometimes, but kind of helps me get an idea because when we know the mechanism of, or not mechanism, when we know what happened, it can kind of help us realize the damage that's been done and help us plan an appropriate treatment. Okay.
Yeah.
So kind of, I looked on your chart a little bit, but and we asked you about your pain, but for you've kind of got multiple locations here. Can you tell me about the pain at each of those locations? And we're going to use a scale here from 0 to 10, 0 being no pain, 10 being the most pain you've ever experienced, okay? So let's start in your arm. Kind of what is the pain you're feeling there?
Well, in my arm, it's not as bad as the rest, but it still hurts a lot. It's like maybe a 5 out of 10.
Okay. What about is it ribs?
Yeah, my ribs, they're like the worst, I think. They get to like an 8 out of 10 a lot of times.
8 out of 10, okay. And what is that causes that 8 out of 10, you said? Is there any motion or anything that happens?
It's mostly a lot if I have to cough or sneeze or laugh, it hurts really bad, but it even just hurts breathing normally. Every time I take a breath, I can feel them.
Okay, got it. So I will make 0 jokes.
All right, good. I don't need that.
But no, okay. Yeah, I understand it can hurt with breathing and stuff like that, and there's something I'm going to teach you in just a little bit to kind of help with that, okay?
Okay.
So, and then tell me about the clavicle. That's on the right side, correct?
Yeah, they said I broke my collarbone up here, and it's not as bad as my ribs. It's like maybe a 6 out of 10 usually.
And then I noticed you're wearing a little brace here.
Yeah. Yeah, they said
How's your back?
I broke, some bones in my back here as well.
Okay.
And it's like a 7 out of 10. It hurts me a lot too.
Okay.
Just nothing has really felt good since the accident.
Yeah, it can be kind of hard when we have multiple areas, right?
Mm-hmm.
Probably one feels good one day and one not so good the other day.
Yeah.
Okay. Well, today we're just going to kind of do a little bit of evaluation. I have a few more questions for you I'm going to ask, but I may ask you to do a few motions and they may bring on a little bit of pain. We're not going to try to, torture you today, get that pain to really hurt, but we want you to kind of see the limits of what we can do right now, just know how we can best treat you and give you exercises to do to not provoke the pain, but to help keep you active and healthy while you're in this recovery process, okay?
Okay.
And then, so in order to do that, I may need to put my hands kind of on the structure, on your arm, kind of on your head, on your clavicle a little bit. Is that something you're okay with?
Yeah, that's totally fine.
Okay. So, it seems like you had imaging and those confirmed the fractures.
Yeah, they took x-rays of all those parts, and I think that's how they know they're broken.
Okay. And then, you marked down here on your intake form, you're experiencing some dizziness. Can you tell me a little bit about that?
Well, since it all happened, I've noticed that like in the mornings, a lot of times, I just get really dizzy when I'm getting out of bed. And, I don't know why it's happening. I didn't have it before, but.
Okay. So that's just kind of right in the morning, right as you're getting out of bed.
Yeah, it usually happens like, right as I sit up out of bed, I just get dizzy for some reason. I can't understand it.
Does that dizziness, let's say if you couldn't use the word dizzy, what word would you use?
Maybe it's like the room is spinning, it's like it's spinning around in circles around me, and but I'm really.
And then does that last? How long would you say that lasts?
Probably less than a minute, probably like 30 seconds about.
So less than a minute. Okay. And then after that, you just kind of feel like it goes back to normal?
Well, it doesn't go all the way back to normal, but I would say the spinning lasts about 30 seconds, but then I still feel a little bit woozy, for quite a while after.
Oh, okay. Kind of making it hard to go throughout your day.
Yeah, it's not as bad after, but I'm still dizzy after.
Okay. Okay, that's good for me to know. We're going to make sure to take some precautions to make sure you don't lose your balance today and fall down, and make sure you're safe going home, okay?
Okay.
Are you taking any medications?
Just some Motrin.
Okay.
Yeah, that helps the pain a little bit, but I was on some different stuff at the hospital that really helped, but I'm not taking it anymore.
Okay, yeah, a little bit stronger.
Mm-hmm.
Okay, and then are you having any bowel or bladder problems? This may kind of be weird, but are you having any trouble going to the bathroom or holding it in?
No, I haven't noticed anything.
Okay, and then have you noticed any numbness or tingling, especially around kind of, we call it the saddle area. You imagine if you're sitting on a horse, kind of every area that's touching the saddle?
No, I haven't noticed any numbness or tingling anywhere.
Okay. And then, let's see. It says you're kind of having a little bit more pain, coughing and sneezing.
Yeah, that's when it really gets the worst. If I sneeze, it just kills my ribs.
Just kills your ribs, okay. Okay, and then what are your goals for physical therapy?
Well, I'm on my mission right now, so I just really want to get back to my mission. And so, a lot of that's like walking around to people's houses and knocking on doors, and we also ride our bikes a lot too. So I'd like to be able to ride my bike again. Okay.
That's a good goal, yeah. So kind of walking, biking around.
Yeah, and then, I have to have like my bag. I use like a messenger bag that I keep all my books in to hand out. Okay. So that's like a pretty heavy thing that I carry around a lot.
Yeah, it's kind of hard right now, isn't it?
Yeah, it is.
Okay. And then, okay. Do you have any questions for me before we kind of begin? And
I don't think so. I just want to get better and get back out there to my mission.
Okay, good. To start off, I wanted to take some vital signs. Do you know what vitals are? Kind of taking your heart rate, blood pressure. This kind of helps us know if everything, your heart and kind of other organs inside your body are responding appropriately right now, and that nothing else is going on with that. Is that okay?
Yeah.
We take some vitals. Okay.
That's good.
And then I notice you're in a splint here and a back brace. Have you been wearing that since the hospital?
Yeah, they put me in this at the hospital and they told me to wear it all the time, so I've been wearing it.
Okay. Good. We're going to take that off in just a minute here, okay?
Okay.
So let me just kind of get to your pulse here. I'd ask you to take off your watch, but Okay, and I'll go ahead and take his heart rate here, and then I take his blood pressure, but for time in the video, I'll cut that out. But I would assume it would be normal in our healthy 20-year-old. So, go ahead and do a little pulse ox reading here. So these just kind of help me make sure that everything is going good inside you and that we have nothing urgent to worry about, okay?
Okay.
So, great. And then just kind of based on the, well, let's actually take a look at this real quick. We're going to go ahead and take this off, okay?
Okay.
It's very well secured.
It's doing a lot of good.
A lot of good, okay. Let me just kind of, is it okay if I kind of hold it up for a second, kind of monitor it?
Yeah.
Okay, yeah, every little swelling there, but it's not looking too bad, so that's good. And then, so because of the nature of your injury, it kind of was trauma-based. He was, from what it sounds like and how you explained it, he hit you with the bat and stuff. Just to make sure we've got everything, we want to make sure you're safe when you're in here, and that, so we're going to do a few little quick screens of kind of your neck right back here, okay? So in order to do that, I'm just going to kind of be behind you, and I'll just kind of go through some motions with you, okay? And then I just want you to let me know what you feel, and I'll kind of tell you too. So first of all, I'm just going to come up here. I'm just going to kind of grab your head, feel back here. Any pain back here when I'm pressing?
No.
No. Okay. Then I'm just going to tilt your head down a little bit, and then I'm just going to go ahead and kind of let go. Are you feeling any symptoms?
No, it feels fine.
Okay. And then does this change your symptoms any?
Nope.
Okay. I'm just going to go ahead and kind of move you to the right just a little bit. To the left. Okay. Okay.
Yeah, I haven't had any neck pain at all, which is really good.
Oh, good. Okay. Another one we want to do is just kind of check to make sure your brain is getting enough blood to it. And it seems like you're making very coherent sentences, but just to be sure, I want you to kind of do this. We call it the thinker's pose, so kind of just kind of, well, I guess, well, since we have some other problems going, I'll just have you look to the right all the way, okay, and just kind of look into my eyes, okay, and just I want you to tell me about the last thing you did on Monday. Or tell me about your day Monday just a little bit.
On Monday.
Yeah.
Last Monday, we went over and saw some people. They fed us a really good dinner.
Now bring it over here and I'll look to the right.
Yeah, I love all this food here in America. They made some really good stuff for us.
And then can I have you look up? Okay, any symptoms with any of these motions?
Nope.
No? Okay, good. There I was just kind of looking in his eyes, looking, do you see him any double vision? No, no. He was able to keep doing forming coherent sentences, so we're not really worried about the vertebral artery there. And then it looks like none of the motion in his neck has been limited. So, okay, next I just want to do a little bit of kind of motion of the upper extremity, okay? So I know we've got this right shoulder here, and it sounds like they gave you some precautions, kind of things to avoid doing. Do you remember those at all?
Yeah, they said on this side I'm not supposed to lift my arm like, above shoulder level.
Okay.
And then on this side, I think they said I could move it around, but I'm not supposed to push on my hand, and I'm not supposed to push on my hand on this side either.
Yeah. So, yeah, for this arm, we want to make sure we're not using it in any way to press off. So when you're kind of getting up from sideline, we don't want to make sure we're pressing off. And then on this side, it's okay to press through the elbow, but since we've kind of fractured down here in our wrist or in our hand, we don't want to be using our hand at all to press up. So if we have to press up with our elbow, that's okay. This is just kind of things you got to think about. I know it can kind of be hard, but you'll have that splint on and brace just to kind of be like a little reminder for you not to do those motions, okay? Speaking of those motions, it sounds like you had some dizziness getting out of bed, so I just want to run through real quick this motion sensitivity quotient with you, okay?
Okay.
This is just kind of a few motions that we're going to do, and then this will kind of tell us what those motions are that you're getting dizzy and stuff like that. For sake of the video, it's probably going to take too long. So most of the motions I don't think are going to cause us dizziness, just the left Dix Halpike. So I would document that and write it down. So we did that, kind of figured out that you're kind of getting symptoms going back lane left, and that's kind of is matching up with what you've told us about being in your bed, rolling out of bed, and you're getting that dizziness, okay?
Yeah.
So now we're just going to move into a little bit of screening, okay? Just do a few, we call this a systems review. So what we're going to do is I'm just going to do kind of light taps on your skin on both sides, kind of on both of your arms, and I just want you to tell me if they feel the same or different compared to the other side. And for this, I'm just going to have you close your eyes, but I'm just going to tap kind of here, and down here. But so I'll have you close your eyes, and I'm just going to pull up your sleeves if that's okay.
Yep.
I'm just going to get kind of right up here to your shoulder. Okay, then go ahead and close your eyes. Tell me, does that feel the same or different compared to the other side?
Feels the same, I think.
Okay, now here.
Yeah.
Can I have you put your hands flat on your lap? Okay, now here.
Feels the same. Same.
Okay, now I'm going to do one kind of mid-thigh. Is it okay if I have you pull your shorts up just a little bit?
Yep.
You comfortable with that?
Yep.
Okay. Close your eyes.
Yeah, feels the same. Same.
Okay, and can I take your socks off?
Yeah.
Okay.
Same.
Okay, good. Now we want to just do a little bit of muscle testing, whereas that we've kind of got a lot going on in the upper extremity. We're kind of going to defer that for today and wait a little bit. I know you just recently had this trauma. It can be really painful, okay? But we're going to start out. Also defer, we normally will have them, well, for the camera, I guess, I'm going to defer hip flexion too. I think that could put a little bit of strain on the back, and we won't want to do that at this point. So first of all, can I have you kick up your left leg, kind of kick it out like you're going straight, and then just bring it back just a little bit and hold right there, okay? Don't let me move you. Hold, good. And then on this side, kick it all the way out, and then hold it and don't let me move you, okay? Hold, good. So we've got some strength in there. Can I have you lift up your feet? Okay, I'm going to press them down, don't let me press them. Hold, good. Same thing over here, hold, good. Now can I get you to lift up your big toe? Okay, hold, good. Hold, good. Last one, can I get you to press down on the gas pedal like you're driving a car, okay? I'm going to try to pull you out of this position. Don't let me move you. Hold, good. Hold, good. Okay, so looks like we have some good strength in there, not like a complete loss, but you are saying you're kind of feeling a little bit like you're not as strong as you used to be.
Yeah.
And also maybe, did you say a little fatigued?
Yeah, I feel like my legs are weaker, and I feel like they get really tired, like they get burning when I'm, just doing normal stuff like they wouldn't usually do that.
Okay. And this is just since the accident?
Yeah, I think it's because I haven't really moved around a lot. I was in the hospital for 3 days, and I hardly stood up, only a couple times a day, so.
Yeah, and that can be kind of tough, and your body kind of takes that toll, but we're going to make sure we get you back to being able to go out and walk and bike and do all that stuff you need to do to complete your mission, okay?
Yeah.
So, just because we're having this dizziness, there can be problems that are maybe a little more serious, and I don't think you have any of these, but just to double check, we want to do a few little tests, okay?
Okay.
So the first one, I've got my pen here. I'm just going to kind of hold it about this far away from you, and I just want you to follow the tip of my pen with just your eyes. No head movements, okay?
Okay.
Just the eyes. So let me know if you feel any dizziness, recreation of that, or nausea, or a headache, okay?
Yeah.
Nothing?
Feels okay.
Okay. And then I want you to go ahead and look over here to the right. I'm just going to kind of looking at your eyes. Okay, now look over here to your right. Okay, no nystagmus there. And then I want you to jump back and forth with your eyes, looking from here to here, not moving your head, just kind of looking back and forth, looking at each of them for about a second and jumping back and forth. Okay, good. Okay, and then for this last one, I know it's kind of hard to lift your arms up out in front of you, and for this one we normally will have people lift their arms clear out in front of him. But what I want you to do is just kind of keep your arms a little kind of at your side, just kind of like this, and I want you to just kind of stare at your thumb. And I'll give you this pen so it kind of extends the range. I just want you to look out at this tip and just kind of go back and forth, staring at that pen, trying to keep it in focus. Okay? Let me know if you get any dizziness or nausea with that. Okay, good. Those are good signs. Those are just quick little things we want to do to screen out, just to make sure we're keeping you safe and that we don't need that you are appropriate for physical therapy. So next, I'm just going to kind of give you 3 fingers here. I just want you to kind of grasp and kind of give them a good squeeze, okay, as much as you can. Be a little gentle on that left side. I don't want you pushing past pain at all, okay?
Yeah, it hurts to squeeze with that one.
Hurts to squeeze a little bit, but it is good that we're getting a little bit of strength through there right now, okay? Okay, so next I want to get you up and we want to do just a few tests. So before you move, I'm just going to put this gait belt on you. So this gait belt just kind of gives me an extra spot to hold on should you go to fall. And I know you've got a brace on, but I don't want to be pulling on that brace because that's kind of keeping your back where we want it and keeping that movement limited there, okay? So I'm just going to put this on, right around you.
I may be in rough shape, but I can still walk. I don't know if we really need this.
Yeah, and I know you can walk, and so this is actually just for me. You know, I've skipped the gym a few times and you might fall, and I want to make sure I have a nice, good spot to grab onto to make sure you don't fall, okay? So this isn't for you, this is for me.
All right.
Okay? And then remember when we're getting up, we don't want to be using our hands, okay? So let's go ahead and I'll have you come to a standing. And let me get this seat right over here. Okay. Good. Are we getting any of that dizziness?
Like a little
walk
woozy,
over here if you're good, but
none of the like spinning dizziness.
Okay. Okay, I'm gonna go ahead and have a seat in this chair. Okay. So, because you're noticing a little bit of this lower extremity strength, or just your kind of lower body and your legs, I want to do a test. It's called the 30-second sit to stand. So for 30 seconds, I want to see how many times you can sit in the chair and come up to standing all the way. None of this just like kind of half out, but we want to come all the way out, standing, and then back down, standing again. We're going to see how many times we can do that in 30 seconds, okay?
Okay.
So whenever you're ready, you're going to go ahead and go. We don't want to push off, okay?
Okay.
Good. There's a 1. Good. Okay, good. We got 3. Go ahead and take a rest. So, how are you feeling after that? Are you feeling okay?
I feel a little tired. I mean, when I do stuff with my legs like that, they get a little tired and feel a little bit out of breath.
Okay, so here I've got this scale. It's called the RPE scale, rate of perceived exertion. So here, it's got numbers here all the way up until 20. And so 20 would represent that you are working the hardest you've ever worked in your life, and you're working so hard that like you couldn't do any more, okay? Then 6 here is just like you're sitting right now. You've been sitting for a long time and don't feel like you're having to do a whole lot. Okay, where would you say you are on that scale?
Well, I mean, I don't feel like it was that hard. Maybe I'm working only like a 14-ish or 15, but you know, I just feel like I get tired sooner than I used to.
Yeah, and then that can be pretty common after, you know, you've kind of been bedridden for a few days. You've been in your bed for a few days and haven't been moving, so our body kind of takes a little toll on that, and it's like, oh, well, if we're not moving, we maybe don't need to move. And so it will take a little bit to build that back up. You've been in a pretty severe accident, we'll say. I mean, it wasn't an accident, obviously, but you've been in a trauma. You've experienced a trauma, And your body will take a little while to recover from that, but that's something we're going to work on. And this test will just establish our baseline, kind of let us know that, today Elder Rivera could only do 3, but in a few days we're going to see that, you can do a lot more than that, okay?
Okay.
Okay, so next, I just want to kind of have you stand up, and I just want to assess some balance, okay?
Okay.
So I'll have you stand up. But I guess before we'll have you sit back down one more time, okay? That's a good little practice, but I noticed it's kind of hard for you to get started, to get out of bed. So I want to teach you a few things with that. It's kind of hard when we can't use our arms because, take it for granted. You could do push-ups all day before, right?
Yeah.
But so a few things that can kind of help is just kind of scooting to the edge of the seat. If we're clear back in here, it's hard for us to get up. But if we scoot to the edge, it makes it easy. And then the other thing is we want to make sure we're getting our kind of head over our body. We call it nose over toes. So you want to get your nose right over your toes, and then you're able to push up a lot easier. Does that seem a little easier?
That does seem a lot easier.
So that will just kind of make it a little easier for you for the future. Sorry I didn't teach you that before. We wanted to see what you were doing before your baseline. Okay, but now that you're up, we're going to work on balance a little bit. So I want you to take a step forward here. Okay, and I want you to put your feet together, and we're just going to balance here like this, okay?
Okay.
And I'm going to go ahead and set my timer for right now. We're going to time this.
Yeah, just feel, just a little bit off balance to what I usually am.
Okay, let's make it a little bit harder. You're doing really good with that one. Let's go ahead and bring this right foot forward and put it in front. Okay. Okay. A little harder.
Yeah.
Okay, I'm gonna go ahead and set a timer on this one. Let's try again. Let's set a timer. See how long we can get. Okay. Good. Let's go ahead, sit down, and take a little rest for a second. I'm gonna write those numbers down. So in about 15 seconds, in about 8 seconds. Okay, and then I know you've been working on endurance, and I know as a missionary you're always with your companion. So is your companion here today?
Yeah, he's out waiting for me. We have to stay together.
I'm going to bring him in here, and we're going to have him kind of come in, and I'm going to teach him how to go and kind of use this gait belt to protect you, and so you guys can kind of go walking so you're not confined to your house all day, okay?
Okay.
So companion's in here. I mean, obviously you can't see him for the video's sake, but what we're going to do is we're going to do this 6-minute walk test, and I want him watching how I'm kind of guarding you during this test, and then afterwards we'll have him practice. But we're just going to run through this 6-minute walk test. It's called the 6-minute walk test. So what we're going to do is we're going to get you starting. We don't have a lot of space in here, but we're going to kind of go walking for 6 minutes and see how far we can get in those 6 minutes, okay? So today it might not be very much, but this will be a way for us to measure how you're improving and for you to see your progress as we go throughout this, okay?
Okay.
So let's go ahead and we'll have you get up. Okay. I'm going to go ahead and start my timer, and we're going to start walking, okay, for 6 minutes. And then for the sake of the video, we won't walk 6 minutes, but let's come back. Oh, it's been 6 minutes. Time flies when you're having fun.
Yeah.
Okay, and let's go ahead and sit back up here again on the table. Okay, and I'll have you sit kind of in the, actually, yeah, about right there, okay? Okay, and go ahead and take your, catch your breath for a second. I know that was a lot of work. And then on the RPE scale, where would you say you're at right now? Got it right here.
Yeah, probably 16 or 17.
16, 17?
Pretty tough.
Okay, so about the same as a little more than our sit to stand, but okay. And then I'll record the distance on that. Okay, so now I wanted to talk to you about that dizziness, kind of while you're resting here. I don't know if I'm in the frame, but so there are lots of things that can kind of cause dizziness and imbalance, but kind of looking at what is your symptoms are and just kind of some of the tests we've done. We did that test where we had you in different positions moving, and you kind of rated your level of motion sensitivity to that. So what can happen is, to make up our balance, we have our eyes. We use our eyes to help us with balance. We also use kind of our sensations. So we use kind of our feet to tell us where we are, kind of when we're wobbling. That's why your feet will kind of move, kind of help keep that up. And then there's also something in our head. It's in right kind of behind the ear. It's called the vestibular system. So there's little canals, little circles, and there can be things that can get dislodged inside our head that can kind of fall into these canals. And when they fall into the canals, they're not supposed to be in those canals. So these canals kind of tell us where we are in space. If we're sideways, they kind of tell us like, hey, my head is sideways. You know, this world didn't suddenly shift. My head is sideways. So when things get dislodged in there, it can kind of make it a little extra sensitive to motion. So when you get up in the morning, you noticed, oh my goodness, that kind of makes me dizzy, makes the world start spinning. That's because maybe there could be this little crystal lodged inside this circle that's kind of telling your body, kind of giving false information, if you will.
Okay.
So what we're going to do next is I want to put you in a position we're going to test if my hypothesis is correct, this motion is going to cause those symptoms to come on. I don't want you to be like worried. We're going to bring them on for just a minute, but then we're going to help do some position changes. And this will kind of get rid of that crystal, kind of move it around as we do these positions and kind of get it out of that circle so that that circle goes back to working how it should and keeps you and kind of gets rid of this dizziness and spinning your experience, okay?
Okay.
So I'm going to be here with you the whole time. I'm going to ask you to try to keep your eyes open while you're doing this. There's nothing scary about this. I'll be here guarding you the whole time. You're not going to fall. I'm not going to let anything bad happen to you, but you will get that dizziness back for a little bit. Is that okay with you?
Yeah, I mean, if it'll make me better, that's okay.
Okay. Let's go ahead and I'm going to take off this gate belt real quick because we don't need this. And you're going to lie down on it. Also, I know you have some precautions about kind of leaning on that right arm and stuff like that. So we're going to do these positions to kind of avoid putting pressure through the right side because we're going to have you kind of lay on your back and get onto your right side, okay?
Okay.
And so as soon as we get you down in this position, if we start experiencing the symptoms, I'm going to go right into the treatment. I'll kind of be there to guide you through it. We're just going to kind of have you lie on your back looking to the left. We're going to look to the right, and we're going to kind of roll you on your side, but not onto your arm, kind of back here, off your arm just a little bit, enough that we can kind of get your head looking down. And this is going to kind of move these circles inside our head in a good position to get this thing to fall out of those circles, okay?
Okay.
So I'm just going to have you lift your feet up facing that way. Okay. And then to start off, I want to start on this. We're going to start looking to your right side, okay? And we're just going to see this. So this is a position. I'm just going to kind of grab your head, face you like this, okay? And then on the count of 3, I'm going to bring you backwards, okay? We're going to kind of have your head off the table. Let's have you scoot this way, just a little scoop, just like that. Thank you. And then I'm just going to tilt your head, okay? So you just kind of let your head relax and then kind of move your body along with what I move, okay?
Okay.
So have you look here. And be back like that. And I just want you to keep your eyes open looking at me. Let me know if you get any symptoms of that dizziness or spinning, okay?
No, not really getting it. A little woozy, but not the spinning.
Okay, and we're going to hold it here for a minute just to check. But for sake of the video, we'll have you come back up. So that was a minute there, no symptoms, okay? You feeling okay?
Mm-hmm.
Okay, so this side we're going to do it on this side. This side, I'm going to guess is going to bring on the symptoms, and then we're going to go into some treatment, okay?
Okay.
But so, same thing, we're just going to bring our head and look at me, and then we're going to come down like that.
Oh yeah, now it's starting to spin a lot.
We're starting to spin, okay. Well, I'm just going to hold you here. You're not going to fall off, okay? I just want you to kind of let it pass. Kind of let me know what you're feeling, if your symptoms start to get worse or if they're starting to get better, okay?
Yeah, it just feels like the whole room is spinning around me.
Yep. Let me know when it's starting to kind of die down a little bit or...
Yeah, it's getting a little better now. It's kind of passing like how it does in the mornings.
Okay. That spinning's kind of gone now?
Yeah.
Okay, so we'll hold it up to 2 minutes, but if the symptoms are going away, we're going to go ahead and move into the next position, okay? So I'm just going to we're going to turn your head to the left side, okay? On the count of 3. 1, 2, 3. Okay, and I'm just going to come behind you here. Okay. We're just going to hold this position. Okay, and we're just going to hold this one. How are the symptoms?
No, they're not too bad, really.
Okay. So just a reminder on this next one, we're going to have you roll on your right side, but we don't want to be putting pressure through here because that clavicle is going to hurt if we do that. So I want you to kind of roll onto right here. We're going to roll on there, and I'm going to kind of move your head down so we're facing down. And then after that position, we're going to get you sitting back up. But we want to stay in that position for a little while until symptoms die down, okay?
Okay.
Okay, so on the count of 3. 1, 2, 3. And two right there. Okay. All right, how are your symptoms doing?
A little bit of spinning, but not too bad.
Not too bad. Okay. Good. I like that you're not leaning on that arm, just like I said. Thank you for doing that. I'm sure that's less painful than it would be if we were directly on that, okay?
Yeah.
And I know this position isn't the most comfortable, especially with our back and stuff like this, but this should help the dizziness. Okay. Then last one here, we're just going to come back up to sitting, okay?
Okay.
So 1, 2, 3. Stay in that position, okay? How are you feeling?
Yeah, a little dizzy, but not too bad.
Okay. Then I'll bring you back to normal. Okay. I just want you to stay like this for a second. I'm gonna keep watching you just to make sure. Don't feel like you're gonna fall over anything.
No, I feel okay now.
Okay. So I'm just gonna have you flip for the camera's sake. Back to the other side. Okay. So with that, we should have positioned that crystal out. Studies show that with 80% effectiveness, if we do this 3 times, there's an 80% chance that we got 80% of patients, their symptoms go away of that, okay? So that doesn't mean that this is going to be the one time. This one could have been it, or we may have to do it a few more times. If this was your only issue, we'd go and do it 2 more times today just to make sure, and chest. But as we're going to see you in 2 days from now, I'm going to have you monitor your symptoms. When you get out of bed in the morning, I want you to think about how you're feeling. If you're still feeling that, we're going to do it again next session as well, and then up to 1 more time, and that should get rid of it, but this one could have, okay? So it's not an exact, like, 1 time is the charm. It's anywhere 1 to 3 should get it, and if not, we're going to reevaluate and do something else to help, okay?
Okay.
But
sounds good.
We'll let you rest for a second, but just to test now, we're going to do it 1 more time, kind of put you back in the side position so I can put your feet that way. And then we're just going to reassess real quick. I have them wait long time, but for the video's sake, we'll do it right now. Bring you here, and then bring you down. Any symptoms?
No. I don't
Okay,
think so.
good. We'll bring you
Feels
back
a
up.
lot better.
Feels a lot better. Okay,
Yeah.
good. Okay, so just last thing here. So, well, let me bring the chair in here. Get in frame so you can see my head. But just kind of moving forward, what we want to do is we really want to get that strength back, but right now we've kind of got fractures. We've got a fracture in our clavicle in our arm, and those kind of make it hard to get strength back, work on strength right away. So what we want to do is we want to kind of do some motion to make sure that you are able to keep that motion. If we don't do motion, things start to tighten up, joints tighten up, and they don't move as well, okay?
Mm-hmm.
So what we're going to do in this next few sessions when we work with you, we're going to work on some range of motion, kind of making sure everything is moving. That's just kind of making sure your joint can fully move and stuff like that. We're going to be gentle, making sure we're not damaging these fractures that are healing and not pushing you into pain that you can't bear, okay?
Okay.
About the breathing, you said kind of hurts to breathe, hurts to cough, hurts to stuff. So right now I just want to teach you one thing. It's called diaphragmatic breathing, okay? I know that's a big word. You probably don't know what that means.
Doesn't sound
Just
like
kind of talking about our tummy, okay?
Alright.
So when we breathe, we kind of expand. We kind of get bigger. Our rib cage kind of goes bigger and then smaller as we breathe, okay? Mm-hmm. This can put a lot of pain if you've got a fracture in there. If it's broken, it's going to hurt. So what we want to do is we want to kind of learn to breathe through our tummy instead of breathing through our ribs, okay? So to do that, I'll have you put this arm kind of up here on your chest and this arm on your tummy, just like this. And as you breathe, I just want you to notice how your hands move. So just keep your hands pressed again. Your hands aren't doing anything, just staying against it. Just notice how you breathe. See how your chest is kind of expanding out a little bit?
Yeah.
So what we want to do on this next one, I want you to try breathing. When you breathe in, I want you to push your bottom hand out with your tummy, okay? kind of helping the motion come through there. This also helps expand our inside, letting that air in without having to expand those ribs and put pressure and really cause pain to those broken ribs. Okay.
Yeah, it does feel a little bit better.
Okay, so this will be something to help with that fatigue you're feeling. If you're not able to breathe properly, sometimes you can get fatigued a little more because you're like, oh man, I feel like I can't take a nice, good, deep breath. So I want you to practice this. Looks like you're doing really good with that. We could have you do them. So when you get up in the morning and you're laying down in bed, I just want you to practice this for a little bit, laying down. Just kind of practice. Put your hands there. I know it seems ridiculous, but these hands help you see that motion to really train that. And it can be kind of a hard motion to learn. So we want to practice that. And you're going to notice a difference as you're like, oh man, it doesn't hurt as much. We want to train your body to do this while you're recovering so you're not getting that pain there, okay?
Okay, yeah, that would be good.
Next thing you want to do is your companion, he saw us do the walking. I want to train him to get you walking at home. I don't want you to be confined to your house all day. I know that can be boring, and I know you're kind of already sensing that fatigue loss from just sitting there, okay?
Yeah.
We're not ready to run yet. We're not ready to bike yet because we still got these fractures, and they're going to cause a lot of pain if we're trying to do these really jostly motions. So I want you doing gentle walking with your companion. I want him like using the gait belt. And for time's sake, I won't show, but I'd sit there with him and watch him do the walking, make sure he is doing appropriate kind of guarding with that gait belt. And he could practice on me if I were to fall, kind of catching with that gait belt. So with those, I want you to go home, check if you're getting that dizziness again. If you are, please be honest with me. Tell me. My feelings won't get offended when you come back in here and be like, you know what, your treatment didn't work. We're going to try it again because it could take up to 3 times. If not, we will reassess and do something else to get rid of that dizziness, okay? Because we don't want you living with that. And then we'll have you do walking. I'm going to send you home with this RPE scale. I want you to walk with your companion. And when you get up here to that kind of 16, 17, where it says very hard, where we were getting there, I want you to take a break, okay? That's okay if we get there with me because I'm trained for that. But your companion at home, we don't want you getting quite up that high just yet. I want you to kind of take it a little easier. Remember, we're just getting back into it, and we will get there eventually, okay?
Okay.
So we're going to try to see you 2 times a week for 6 weeks. That kind of allows our fractures to heal, kind of allows some of the tissue. And then after that, we can go down, we'll reassess and see how we're doing, but we may go down to 1 time a week. And that's when we'll really start working on kind of strengthening and getting you back into being a missionary again, okay?
All right.
So I know that's a long time, seems like a long time, and I know it can be kind of hard. So do you have any questions or concerns for me?
No, it sounds like we got a good plan to get better, so I'll just do whatever I need to.
Okay, sounds good. Well, if you have any questions, feel free to call the office and they'll put me on, okay?
Okay.
So, but we'll see you, we'll get you on the schedule, okay?
Okay, sounds good.
Okay, sounds good. Nice to meet you, Elder Rivera.
You too. Thanks.